Hi, this is Patty and Rada with HIMSS. I'm with Peter Durlach, Chief Strategy Officer at Nuance. Welcome, Peter.
Hi, Patty. Thanks very much. Nice to be here today.
Great. So today we're going to talk about patient engagement. So why is it important for healthcare organizations to have a patient engagement strategy?
Consumers are radically changing their expectations of how they're sort of treated when they interact with a company, and healthcare systems that, historically have not thought of themselves in some ways as a brand. They've thought of themselves as really their core mission, which is care delivery. But as the world changes around them and expectations for immediate access to service, self-service, and just what people expect in the non-healthcare world, that's really coming at healthcare in a major way right now. And as many of the folks know, with COVID, that's just accelerated. So the vast majority of consumers want self-service. They want immediate access. They want to be able to interact with the company they're dealing with, including a health system, across any channel. And what we've seen recently is with COVID and the disruption around that and the introduction of the acceleration of virtual care, not only do you have all these disruptive entrants coming into the market, delivering very easy to access care, but patients are now starting to switch providers, which they never did based on their experience with patient engagement. So recently we've seen data that says almost 40% of patients have considered switching providers in this new world because it's just so much easier with one provider or than another. So the world has shifted. COVID has accelerated that shift. And if patient experience is not a strategic imperative for health systems, it's hard to imagine over some period of time those health systems doing as well as they might, or even surviving if they really lag behind in this critical area.
So where should an organization start? So what advice do you have about what they should include in their patient engagement plan?
They need to pick the high value use cases that are achievable in a quick amount of time. So where we've seen that be around patient access, patient appointment management, rescheduling, prep and discharge for visits, patient survey and follow-up. Even some areas in remote patient monitoring have been quite successful. But when they do that, what a lot of systems are doing that we don't think is the right thing to do, and we've heard this from clients, is they're picking all these siloed applications. So what they end up with is a hodgepodge of systems from multiple vendors, which nobody wants. So what you need to do is you want to end up with one common infrastructure that can support these different use cases. So it's balancing sort of those high value use cases that you can execute on while you have an overall strategy that at the end of the day, you want to have one infrastructure that connects to your CRM, connects to your EHR, and then can spin off these different applications.
So what are important considerations when selecting a patient engagement solution provider?
You want an omni-channel platform for this digital front door transformation. Again, as I mentioned, you don't want to end up with one platform for your web chat, another one for your patient access and IVR, another one for your SMS system, and then another one to deal with like the social messaging system. It's not going to work. So you need a platform strategy here that can work across channels. Number two is you need some sophisticated AI technology to really power this, because at the end of the day, it's not that hard to build an app that sends a text message to someone. What's hard is to build true AI that drives up the performance of the technology. Because at the end of the day, what every client wants is drive up their client experience scores, whether that's NPS or something else, significantly reduce their need for human labor on some of these tasks so they can manage the labor for the value-added capabilities and drive up revenue. And that's all based on how good the technology is. The third thing, you have to believe the system integrates well to your back-end system, your CRM, Salesforce, Microsoft Dynamics, for example, your EHRs for sure, but also your telephony infrastructure. Although the digital non-voice channels are very popular, significant volumes of interaction still happen over your 1-800 telephone system. So you need a system that not only connects to your CRM and EHR, but connects to your telephony infrastructure like Genesys, Avaya, and Cisco. So you need a common infrastructure that works well across that. And then the last piece is no technology is perfect. So you need to mix humans with technology. And the metaphor we use is you want like a relay team. So if you have an interaction that can start on a virtual assistant channel, but you want to then escalate to a human, you want all the information that's been captured in the virtual channel to go to the human. So when you as a consumer get transferred, you don't have that feeling like, oh my God, I just said all this stuff again. I got to repeat myself again. It's so frustrating. And secondly, for the human on the other side, They don't want to have to look up all this information. They want to have an intelligent pass of information. Well, you can have the other direction too, where maybe it's a complex comorbid patient you're monitoring at home. They want to talk about something. You want your nurse navigator to have that initial conversation because it's a very personal, complex clinical discussion that no technology is going to automate. But at the end of the visit, maybe you need to schedule a follow-up. Why can't at the end of that call, you have a virtual assistant complete the scheduling part, which a virtual assistant can do really well. So mixing humans and tech is really important. And the reason that these are all important, we've seen from other industries that if you do all these things, you drive superior outcomes around experience, cost, and revenue.
So how can healthcare organizations justify investing in a patient engagement solution?
Yeah, so I would say in a way, how can they not, given the first way that I started? But everyone has cost pressure. So at the end of the day, it's easy to say that, but you still got to justify the ROI. So the way we look at that is a couple of ways. Number one is, again, there's significant displacement of labor costs with this technology. One of the interesting things we found from other industries is when you create a rich consumer experience technology infrastructure to connect with your consumers, which everyone wants to do, the number of touch points skyrockets, which is what you want. You don't want to just talk to the patient 3 times a year. You want to be in touch with them. That's the whole point. There's no way you can staff with people to support that volume of touch points. It's impossible for any client, especially a health system. So a lot of the ROI comes on labor cost displacement because the tech can do a lot of the work for them. Second big one is revenue. A lot of these early use cases are around patient access. And whether you're in a fee-for-service, a lot of your fee-for-service business, people have open slots. It's like an airline industry. Once a slot goes away, it vanishes. It's perishable. If you have patients that are at risk, where you're on some sort of capitated model, the more you're connect with them, the better you help them manage their care so that the disease doesn't progress and they don't show up in the hospital again. So the ROI is all trying to circulate around this. And then, in kind of the more sophisticated environments, people also say strategically, back to the first question you asked, if I'm not a really easy, high quality care delivery organization, my patients are going to go somewhere else. So what percentage of that's going to happen over what time is hard to model, but I think most health systems understand that in addition to the hardcore ROI they can justify in the near term, there's a real strategic risk that if they don't do this, they're going to start to see patient volume start to waft away, especially in more of the sort of specialty areas and low acuity where the patient does not have to be in a hospital bed, because those are the areas that the disruptors are coming after, where you don't need a bed to deliver the care.
So what key capabilities does Nuance offer and how do they work with the EHR?
Number one is we have an omni-channel infrastructure, true omni-channel. So we can build an application off the shelf for custom, or a client can do it, that truly allows you to map out a patient journey. And then you can build one app that then supports your access center, the IVR, the voice channel, and all the digital channels. You don't have to have these siloed solutions. It's one infrastructure. That thing also provides you with one set of back-end connections. So when you connect to the scheduling system in our application, that integration supports whether the patient's coming in on your IVR, they're coming in on your website, or they're texting you. So you don't have to rebuild all these capabilities. 2 is we've collected millions of interactions of how consumers ask questions about things, including in healthcare. So the AI only works as well as as much of the data you have. We have 20 years of data of how people do these types of interactions over both the voice and the non-voice channels. So that's what drives up the AI performance. And there's no way around that. You have to have the data to do that. The third thing is, based on our deep relationships over 20 years with the EHR vendors, Epic, Cerner, Meditech, Athena, and others, we have these great relationships for our physician providing solutions. We're now leveraging all that for deep integrations, whether it's in the Cadence and MyChart on Epic, or it's in the Cerner equivalents or Meditech. So we have large experience there. Also, in all our deployments outside of healthcare, hundreds of deployments with Salesforce.com, with Microsoft Dynamics, with Genesys, Avaya, and Cisco. So we're not starting from scratch in this arena. And the last piece is, our technology allows you to decide when to escalate to a human, as I mentioned before. So not only can you cross channels, but in that same infrastructure, you can decide, at this point of the dialogue, based on the type of patient and what they're asking, I want to send it to a human. Could be a patient access center agent, Could be a nurse navigator if you're monitoring some kind of a set of patients for care coordination. So for us, those are the key sort of pillars that we have that are designed to, again, drive the outcomes that our clients look for.
Great. And my last question is, what makes Nuance patient engagement solutions unique compared to other solutions?
Yeah, so as I alluded to here in the last couple answers, is really the unique things are, not surprisingly from our perspective, the things that are required to really drive success. So no one else has an integrated omni-channel platform like that we do across the channels, as I mentioned. Secondly, no one has the level of experience and data across industry and use cases that we have to drive up the AI performance. And so what you end up with is a single platform that our health system clients can use versus this wide array sort of silo things. And also that platform that they're using is exactly the same technology platform that they already use today on the physician side. So when their doctors dictate into Epic, dictate into Cerner, dictate into Meditech, dictate into Athena, or use the virtual assistant commands of, hey, Epic, hey, Cerner, okay, Meditech, it's the same exact technology that allows clinicians to navigate, queue up orders. That's exactly the same technology that not only brands like FedEx and Delta use, it's the same technology that you use for the patient virtual assistant. So when a patient calls on your phone and asks to schedule an appointment, or they're on your website trying to figure out how to set up for a telehealth visit, it's all the same tech stack. So again, as our clients look to say, what platforms can I rely on, my EHR, et cetera, our technology is a combination of all of this experience that they can deploy across all these use cases, both for provider use cases and on the patient side.
Great. Thank you, Peter, for being with us today.